sections, these are becoming more common. I believe 1 in 3.
Yeah, about a third of Australian
Yeah.
babies are born by Caesar now. Yeah.
Yeah, and it generates a lot of emotion in Australia, and it's a bit of a topic. But, if someone comes to you and says, I want a cesarean, not for any medical reason, but it's just their preference, what's your approach? How do you have that conversation?
Yep. So I always start by saying, I'm going to support you no matter what you decide.
Incredible.
Okay, that's my first sentence. But then I say to them, but I want to make sure you understand the decision and the pros and cons of the decision, and I want to understand why you're making that decision. Because ultimately, I don't care, I don't discriminate on a person's choice. I want to be really clear that they're making their choice for reasons of correct information and that they haven't been misinformed by community, social media, friends, whatever. Okay. And so my first step is to explore why they say they want a Caesar, and then to try and, really drill down and work out whether those reasons are not whether I think they're valid reasons or not, but whether I think they're based on correct information. Okay. I think the decision making is valid no matter whether I agree with it or not, but I want it to be based on correct information. Yeah. And sometimes it's things like, I'm worried about pain. And I'll actually say to someone, well, in fact, if you're worried about pain, you probably shouldn't have a Caesar, because you'll have more pain with a Caesar after the birth than you will for at least the vast majority of vaginal births. And if you're worried about pain in labour, we can talk about putting an epidural in right at the very early stages of your labour, and you can effectively have a pain-free labour. So sometimes we come to a point where she says, well, okay, well, that actually makes sense. Maybe I hadn't really been thinking about this the right way. Okay. Yeah. And then if she changes her mind and aims for a vaginal birth and has a positive experience, that's great. And if she says, thanks, but I still want a Caesar, that's also great.
Yeah.
Okay. So, we've also dealing with the other side of the coin, of course, of people who really don't want a Caesar and for whatever reason find themselves in a situation where they're being told that they should have one. And then again, we have to bring people on the journey with us. So this is very much about collaborative decision making. So we're really respectful of a woman's right to control her own body and decide what happens to it. Okay, but we still want to give the correct medical advice around risks and outcomes and all of that sort of stuff. And whether a patient chooses to accept that advice and run with having a Caesar, or whether she chooses not to accept that advice and say, well, you may well be that you've said those things, but these are my priorities. Again, that's very much a choice that she's entitled to make. I think what's most important is that it's made collaboratively and it's not told to someone that this is what they are going to do, right? And